Hi, I'm Lindsey Ash, and I'm presenting my capstone project, which is CLOVER Children's Hospital. So, to begin, why a children's hospital? And it all begins with psychology. The intersection of design and psychology has always been incredibly fascinating to me. Just the smallest aspects in a product or environment can completely influence or change someone's behavior. And I really want to explore this in my capstone, and I fell onto a couple of options where I could do this. Those being healthcare, schools, or the home itself. And I decided to go with healthcare just because every design decision in the field is incredibly thought out and researched. And it is also a very broad field that I could work in. But that is an incredibly broad field, as 36.2 million people were hospitalized in America in 2019. So I looked into it and I decided to narrow my scope. So 1 in 6 discharges from those hospitals are aged 17 or younger. This is a bit more manageable, coming out to be about 3 million a year. However, about only 18.7% of those discharges are ages 5 to 17. The majority of discharges are neonatal. So I decided to work within this specific age group. So here's where the psychology comes in. Hospitals are naturally stressful places, but they can be even more so for minors. It's a new and confusing environment, and they're uncertain of what's going to happen. They oftentimes don't have a say in their medical decisions, and it feels like everything is just happening to them. So during admittance, they often experience symptoms of anxiety, depression, helplessness, and stress. And these can even progress after discharge. Some children develop PTSD, major depression, anxiety disorders, sleep disturbances, social withdrawals, and medical fears. And it can even go beyond just psychological. The length of stay for depressed patients was about 3.43 days longer and cost $3,000 more than non-depressed patients, according to a study done by the Rutgers, New Jersey Medical School and the Dow Medical College. So, how might we reduce the stress of hospitalized pediatric patients and encourage their recovery? So, this presentation is broken down into 4 sections, which I'll take you through. First, I'll start with the research and go into the refinement of that research. Next, we'll look at the development, and finally, the deliverables. So starting off, we are going to talk about biophilia, which directly translates to love of life. This is the design theory of incorporating nature into spaces and the benefits these give. There are a couple different types of biophilia. You have direct experience, which is light, air, water, plants, animals, weather, natural landscapes, and fire. And then you also have indirect experience. So images of nature, natural materials, colors, and shapes, simulating natural air and light, evoking nature, and biomimicry. And the benefits that these give are it reduces stress and anxiety, it lowers blood pressure, it accelerates healing, it improves mood, and it even reduces the need for pain medication. And then there's also supportive design. This was developed by Dr. Roger S. Ulrich, and he studied how design in hospitals can cause stress and the ways to combat that stress. So he developed a couple of different criteria. So perceived personal control. This includes the bed position, room temperature, lights, access to items, personal items, decor, noise. Both the excess of noise and sensory deprivation can elevate stress levels. So basically anything in the room that the patient can control. Next, you have single room occupancy. This allows for more privacy and control of the space. There's positive distractions like technology, games, friends, family, nature, art, all of those. Also social support, so a community helping out can take a lot of stress off the patient and their caregivers and really help them to recover quicker. And then also communication. Knowledge of what's happening around the patient can help ease their anxieties of what is coming. So I identified 4 main stressors that I need to be aware of. So lack of control, uncertainty of medical procedures, no privacy, and noise. And I try to keep this statement in mind, that a relaxed patient equals a quicker and healthier recovery. And there are 4 main elements I want to incorporate into this project. And those include access to sunlight, incorporation of nature, perceived control, and noise reduction. And I decided to develop for 3 main groups. Those are patients aged 5 to 12, patients aged 13 to 17, and the parents and guardians of those patients. Now, starting off, let's take a look at hospital rooms right now. So this is one hospital room that I found online, and some of the positives with this is you have the blues and greens, so the natural cool colors, you have the nature imagery on that one wall, and you have the LED lights, which really give a bright environment. However, some negatives that these do have is there are very oversaturated colors, so they're not really conducive for relaxation. They just kind of hurt your eyes. And it's also a very sterile environment. There's not really any comfort to this room. It's just kind of bland. Next, we have this one. And some positives you have with this is the wood paneling, really bringing in that biophilia with the wood, and also the sliding door in the corner. That is great for the reduction of noise because you don't have the slamming of doors. It's very quiet when you move it. Some negatives with this, however, is it's a lot of wood, and that contributes to there's not really any color in the room, so it's just kind of really sad and beige. And finally, the last hospital room we're going to look at. So some positives with this one is you have the wood again, and it's not completely overwhelming like the last one. You also have some really good color in here, and also some really great storage. This is really important if a family is staying for a long period of time. They want to have space to put their own items. However, some negatives with this is you have the outdated look with the patterns and the kind of the materials, and then also you have that really uncomfortable couch in the corner. Parents are typically staying in the rooms with their child, and they need a good night's rest as much as the patient. So some criteria I wanted to keep in mind for this project was, number 1, reducing the clinical feel of the room as much as I possibly could. I wouldn't be able to eliminate it completely as this is a hospital, so there are rules and regulations and codes and restrictions that I have to adhere to, but making it as comfortable and as comfortable as I could was really important. Also including a fridge to store affordable food. Typically, families are staying in these rooms for days on end, and hospital food can be very expensive, so letting them keep their own food in the room with them would be really nice. Also, a comfortable space for the parents to sleep. Some positive distractions, like just entertainment and pictures and things like that for the patients. And I also did not want to overwhelm the room with technology. They're already surrounded by a lot of strange equipment and machinery, and I didn't want to clutter the room or just kind of overwhelm them with all these new devices, so keep it simple and clean. So starting off, I have the mood board for the kids' room. I really wanted to keep this bright with a lot of colors, some soft shapes. I wanted to have a friendly atmosphere to this, and I want to put them at ease and make them feel comfortable in this space. And some of the materials I wanted to include for this is the terrazzo, which is a really great material for flooring, as it is super durable and you can do a lot of different colors with it. Next, the wood for bringing in that biophilia. Frosted glass to help with privacy. Some acoustic panels to help reduce the noise and also make them a little bit fun. And also nature imagery to really bring in more biophilia as much as I could. Next, we have the teenager room. So for these, I wanted to have deeper, more subdued colors than the kids' room to just give them a more mature feel. I want to give them an environment where they don't feel out of place at their age, because there's nothing worse than being a 16-year-old stuck in a room that is clearly designed for a elementary schooler. So I want them to feel like they're being respected and listened to and give them that space. So for this, I went with a more mature color palette and more mature decorations. I kept the terrazzo and the wood and frosted glass and all of that, but just a few minor tweaks to give it that more mature feel. And finally, I have the study for the parents and guardians. This would be a workplace for them and a space where they could go to and decompress. Typically, parents don't really have a space for themselves within the hospital. They are either typically just staying in their kids' room, or they try to find a quiet lobby or corner of a waiting room where they can get some work done. And I wanted to provide them with a space where that was their own and they could just work without interruptions. This would have 3 different areas in it. So a social area for more, so a social area that would be a comfortable space for casual conversation and relaxation. A work area, so this would include desks, access to computers, printers, etc. And a quiet area, so private cubicles for phone and video calls. And this would be the material board for that. So you have, again, the wood, the frosted glass, some common themes throughout, and some also iron and some plants in there as well. So now we are going to talk about the floor plans. This project was completely conceptual. I did not have a client or was working within a actual hospital space. So this was a project that I developed that could be a wing that could be attached to a hospital or just make up a couple of floors of a hospital. So the first floor would be the activity floor. So this has the study, which is in the green for the parents, the activity rooms for the kids and teens, and then you also have some nurses station and offices on that floor as well. And then you have a small little grab-and-go market, so for snacks, cold drinks, anything they might need. And moving up, you have the patient floor plans. These are the same between both the kids and the teens. These have 12 rooms and a conference room for meetings with the parents or the patient's team, a lounge area for the family to either wait, or a space for a larger family to visit in rather than cramming into one room, staff rooms, all of that as well. And here's a closer look at the patient's rooms. So when you first come in, you have the staff and nurses area, and then you have the patient area taking most of it, and then you have the parent area in that one corner. So flipping back to the study, this is the parent workspace. So you can kind of see the 3 separate sections. So you have the social area right here, the workstation, and the quiet area. I also included a small little kitchenette for them to just get coffee, warm food, just anything they might need. Here's a closer look at the study areas, or at the work area. So you have some computers, desk space, and also some printers, staplers, hole punchers, whatever they might need to organize medical documents or just personal work documents. And here's the more quiet area. So you have the private seating, and then you also have the soundproof cubicles to take phone and video calls in without disturbing everyone around you and without being interrupted. So going up, we have the kid floor. This is for ages 5 to 12. So really bright and fun. As you can see, there is a nurse's station right outside of the elevators. So security is a huge must in pediatric hospitals, so nurses would be able to see who's coming and going, making sure that no one strange is coming in or out. In this, you also have the acoustic panels on the ceilings to help with the noise reduction. And also the nature imagery. It's very abstract in this, but it still invokes that nature feeling. You have the lounge and waiting area right there outside the elevators, so parents, families can come and visit. So here are some of the patient rooms. As you can see, there are big numbers on the doors, so people can easily find their way in, and the glass is frosted for privacy. The doors are also sliding to reduce that noise in the hallways. And you have more of the plants incorporated just for more nature. And here is one of the patient rooms. As you can see, there is a big window for lots of sunlight, and a desk right there so kids can do their work. Here is another angle of that one wall. There's the refrigerator included right down there underneath the desk. You also have a whiteboard on the wall to let the kid know what time their appointments are, what's going on in their day. Some hospitals allow patients to choose when their appointment times are going to be, which gives them a great sense of control. And then you also have more nature imagery on that one back wall with lots of color. Here is the patient bed, and as you can see, there is LED lights in the bed, so kids could change the colors of these, give them a little bit more control in the room. And more acoustic panels on the ceiling to help reduce that noise. And here's the corner from the parents' view. Encouraging kids to hang up their own pictures, drawings, etc. would really help them to make the space feel like their own. And we are moving on to the teen floor, so this is exactly the same as the kid floor, just a bit more of a different color palette and more mature feel, so not as many bright and colorful decorations as the kids. Of course, you have the nature included in there, and the acoustic panels to help reduce that noise. There's the lounge for them. And here is the view of their halls. Again, more mature decor. There is a picture of one of the patient rooms. And the inside of one of the patient rooms. Again, with the large window for that sunlight. The color-changing LEDs for that control element. You have the nature imagery on that back wall. It's more subdued than the kids' wall, but still a lot of green in there. Acoustic panels, of course. And the view from the parents' area, and you have the same whiteboard for that control. So some things that I personally got out of this project was experience with research. I researched a lot with psychology and biophilia and children's psychology. It was really fascinating and it was really great, and it was also a completely new field for me with medical design. I got to learn a lot from people and articles, and it was really fun to challenge myself with that. I learned a lot about interior design and the flow of rooms, and I really challenged myself with my technical skills, so CAD and rendering and all of that was a really nice challenge for me. So thank you so much for watching, and I hope that you learned just a little something new.